Childhood responses to trauma and common coping strategies. pokingholesblog.com. Childhood responses to trauma and abuse. When a child experiences ongoing trauma or abuse, they develop strategies which become coping mechanisms that enable them to function on a day-to-day basis. These strategies help the child detach from the emotional and physical pain associated with the trauma and abuse. These responses are automatic in that they happen without the child's knowledge in order to protect their psychological survival. Two main types of trauma responses. 1. Hyper-arousal, also known as fight or flight, includes vigilance, resistance, also known as freeze, defiance, and aggression. 2. Dissociative, includes avoidance, compliance or appease, dissociation, and fainting. Two factors that determine a child's trauma response: the age of the child and the nature of the threat. The younger the child, the more likely they are to use dissociative adaptations rather than hyperarousal responses. Hyperarousal responses. Number 1, fight or flight. An instinctive response to try to overcome the danger by fighting or run away from it, flight. Infants and children are rarely capable of being able to fight or flee. If a child's initial cries for help are ignored and no help arrives, or if the trauma is being inflicted by their own parent or caregiver, the child will shift from hyperarousal to dissociation. Number 2, freeze. Ongoing trauma or abuse may cause a child to freeze. The advantage of this response is that by being still or quiet, the child is less likely to be seen or heard, which buys them more time to prepare how they are going to respond. Inside of the child, their anxiety increases and their cognitive processes decrease so that it allows them to figure out how to respond to the trauma. When a child has been traumatized, they are most likely to use this freezing mechanism when they are feeling anxious for any reason. If the threat continues to increase, the child will shift from feeling anxious to feeling terrorized, which causes a switch from the freeze response to dissociation. Two types of childhood coping strategies. Avoidant strategies, which are dissociation, splitting, fragmentation, denial, and forgetting, and reframing strategies, which are rationalizing, minimization, and please or appease. Avoidant coping strategies. Number 1, dissociation. Mental processes that create a lack of connection between the child's thoughts, memories, feelings, actions, or sense of self. When trauma and abuse are ongoing, it is too much for a child to comprehend, so their coping mechanisms become overwhelmed. The child's best option for psychological survival is to dissociate. Dissociation shuts off the trauma or abuse that is happening from the child's consciousness. Number 2, splitting. Failure to integrate the positive and negative qualities of self or others into cohesive images. People are viewed as either entirely good or bad, which is also known as black and white thinking. The presence of splitting indicates that the trauma and abuse occurred at a very early age. Splitting allows the abused child to preserve an appearance of normality in the face of very negative experiences. Children deal with the confusion of both good and bad in an abusive parent by creating distinctive categories in their mind between good mother/father or bad mother/father. Fragmentation of personality. When childhood trauma or abuse is chronic, the personality becomes organized around the central principles of fragmentation. Fragmentation of personality involves some parts of the personality becoming detached or dissociated from other parts. Fragmentation serves to keep the trauma out of the conscious awareness of the child. Number 4, denial, an unconscious defense mechanism that denies thoughts, feelings, wishes, or needs that cause anxiety. The mind's way of staving off complete dysfunction precipitated by overwhelming trauma. Allows the child to survive and function until a time at which they are able to come to terms with the trauma or abuse. Unconscious operations that deny that which cannot be dealt with consciously. Number 5, forgetting, includes recovered memories and traumatic amnesia. Memories of traumas are quarantined from consciousness in order to protect the self from being overwhelmed. The presence of traumatic amnesia points to the significance of the victim's age at the time of the abuse, as well as the duration of the abuse. More recent evidence suggests that amnesia is more likely to occur when the child is dependent on their abuser for survival. Reframing strategies. Number 1, rationalizing. When it becomes no longer possible to avoid reality, children may try to justify their abuse by constructing a plausible reason that would explain it. A common rationale is the child believes that they are bad and therefore deserve the abuse. This rationale serves 2 purposes. First, it allows them to maintain faith in their parents, and second, it also allows them to believe that they can change the situation by being good. Number 2, minimization. This is reducing an experience to the smallest possible effect. This is often used as a coping strategy when denial fails to work. Number 3, please or appease. This is trying to be good by adopting pleasing or appeasing behaviors. The child tries to prove his or her loyalty and compliance and gain control in the only way possible, by trying to be good. Seeking affection. Unable to establish a sense of safety, abused children frequently seek external sources of comfort and solace. Abused children often paradoxically seek the affection of the very individuals who abuse them. Coping strategies used by adult survivors. The coping strategies a child used during childhood are often also used in adulthood by the adult survivor. For example, the tendency to dissociate. This use of childhood coping strategies can impair the development of more adaptive social, cognitive, and emotional coping mechanisms for adult life. Adult survivors often continue to use their childhood avoidant coping strategies, such as dissociation, splitting, fragmentation, denial, and forgetting. Thank you for watching. Don't forget to click like and subscribe, and check out some of my other videos and my blog at pokingholesblog.com.